This is Heidi Gullett. I'm a family and public health physician, and I see patients at Neighborhood Family Practice, which is a Level 3 patient-centered medical home. And today I will be discussing what is a PCMH, or patient-centered medical home. According to the National Committee on Quality Assurance, or NCQA, that is one of the certifying bodies for patient-centered medical homes, their definition is that a patient-centered medical home is a way of organizing primary care that emphasizes care coordination and communications in order to transform primary care to the expectations of the patients. It is really an interprofessional, team-based model of delivering primary care, where comprehensive and coordinated care happens over a continuous period of time. As you can see in this slide, courtesy of Dr. Mimi Singh, you have a foundation of capacity and accountability. So access is really, really critical for patients in a PCMH. And then you see that there's continuity of care as a critical foundation, as well as a personal provider. It does not have to be a physician. It could be a nurse practitioner or a physician assistant or a physician. And then you see moving up that there's care coordination, integration, safety and quality are critical foundations, and that there's a whole person orientation, so that we're not simply treating a few of those multiple determinants of health, but we're doing our best to treat all of them and to work simultaneously with a team of folks who can actually do that. My patient-centered medical home where I work, I am part of the Blue Team, which is one of many teams in our practice, and my team consists of front office staff, nurses, medical assistants, a patient advocate, physicians, nurse practitioners, a quality manager who's also a nurse and has a master's in business administration and is a population health manager in our practice. So you'll see that a very diverse team includes many people who are aiming to do everything they can for that patient. And I also failed to include behavioral health, which is one of the most important components, in that there's behavioral health integration. So behaviorist also is a key part of our team as well. Patient-centered medical home as compared to a traditional practice. Our patients are not those who choose to just come in for appointments, but we actually view our patients collectively. Our team has patients, and they are a population that are served by our practice. So not simply a group of people who might choose to come here, but a group of people that we actively work alongside with them to manage them. And we also don't just respond reactively to acute care. Of course, we offer same-day appointments and open access. That's very, very important in a patient-centered medical home. But we also reach out to our patients, so we systematically assess their needs. And that can only be done if you have processes and systems in place. So quality and process improvement are critically important for us. We use registries and we use a lot of quality improvement tools to ensure that we're meeting all of the standards that our patients expect and that they want. And we listen to them. So our board is 51% or more always of patients who are served in the practice, so that we make sure that we are always meeting the needs of what those patients need. That is not particularly a patient-centered medical home requirement. That's actually a community health center requirement, but I think it very well fits with the patient-centered medical home principles. And then the other piece is around team. And medicine cannot continue with a lone physician telling other people what to do. It's really got to be about team, and everyone has to be empowered to work at the top of their training. That's essential, because there are too many things to do, and we don't train physicians to deal with all of the multiple determinants of health. You need to be aware of them, but we are not training you to be a social worker. We are not training you to be a dentist. We're not training you to be a nurse. We're training you to work well with those folks. So it's really important to understand what everyone's role is and what they're capable of doing. The other thing is that it's really important to understand coordination of care. So a lot of people misunderstand primary care in that they think it's the place people go maybe for colds or when they don't feel well and they need some antibiotics. But the reality is that primary health care, when done well, is a vehicle to improve the health of a population. And so coordination of care is critically important when you're looking at improving the health of populations and individuals, and coordination of care is a key principle in the patient-centered medical home for that reason.